MSNBC medical contributor Dr. Vin Gupta is here with me, and back with me, MSNBC political analyst Donna Edwards. It's always good to have you here. So 663 confirmed cases now just in Texas of measles. A local paper in Lubbock, and that's where the outbreak started, says the latest case involves an infected person on a college campus. At this point, how worried should we be?
Well, this is going to get worse before it gets better, clearly.
For sure.
Absolutely. So I think we're all, nothing's a guarantee, but in terms of expectations of what we should be prepared for, every state official, Department of Health official in these states needs to be prepared for greater public awareness campaigns on staying home if you have symptoms concerning for measles, because of course, there's an incubation period between exposure and actually testing positive. Can be up to a week, potentially. And so being aware of your symptoms, staying at home if you're developing symptoms that are consistent with measles is critical. Also developing an understanding of when to get tested. And then, of course, emphasizing, because we just saw the FDA commissioner about a week ago say on national TV, or refuse to say on national TV, that the best way to protect yourself is through vaccination, and to hammer home that message to parents. He missed an opportunity to do that, and so we have to emphasize that.
Yeah, there was an expansion in Virginia of a warning on areas exposed to a child with measles. And as we see this continue to grow, can we remind people why the concern is so great and how easily this can spread?
Well, yeah, first of all, this is probably one of the most contagious, just infectious diseases on the planet, number one. And number two, why is this important? This is more than just a skin rash, Chris, and I think that's what gets lost is often really what happens here. And the concern, especially amongst kids, or if those that are older, is that what lands them in the hospital, especially if they're not protected with the vaccine, is pneumonia-like complications or even swelling in the brain. And that's not just an abstract thought. That's up to 25% of people unvaccinated and exposed. So this is a serious illness, incredibly contagious. One person infected in, say, a college dorm room can infect 9 other people around them within just a matter of minutes.
So, Donna, the Texas Tribune is reporting a statement from HHS Secretary RFK Jr. about kids who get measles. Quote, "Every child who gets measles gets a headline," Kennedy said during the visit alongside Agriculture Secretary Brooke Rollins. "When I was a kid, there were 2 million measles cases a year, and nobody wrote about them." What do you make of that from the top health official?
Well, I think it's just highly irresponsible. When he was a kid, I was also a kid, and the United States was engaged in a very rapid school-by-school, community-by-community vaccination program, which resulted in many years of very, very few measles cases in this country. And so it's so irresponsible. And, what he puts out is that, parents should educate themselves. Well, the internet is filled with disinformation about the way measles spread and the impact of vaccines. And so it's actually his message coming from HHS is saying that the federal government doesn't believe that this is a problem. And that's a really bad message to send to parents and communities. And after all, shouldn't 2 deaths of children be a headline?
I want to ask you about one other thing, Doctor, because there's new guidance from Harvard about a booster shot for adults when it comes to measles. What do people out there watching need to know?
Number one, if you do not know your measles vaccine status, which tends to actually be more people than you think, and you're worried, just get a booster shot.
It can't hurt you?
It can't hurt you.
Because I keep hearing this number like 1957, 1958.
I think part of the problem with our health communications is that it's complicated. And I think we're overcomplicating it. So if you don't know and you were born before 1957, get a booster shot. If you just don't know your vaccine status, regardless of your age, you can get a booster shot. There is this concern here that if you got the measles vaccine, say, between 1958 and 1989, was that an effective vaccine? If that's you, and you don't have titers, because many of us have titers proving immunity, if you're concerned and you know that you got 2 shots, you can prove your immunity by getting just a simple blood test the next time you're seeing your doctor. If you don't want to hassle with that, you can get a booster shot. And so really the bottom line here is if you're worried at all about your protection, if you have an underlying chronic illness or you just don't remember, or you're worried, you can just get a booster shot.
Is there any adverse impact to that, just like a sore arm or whatever, just so people know?
There can be injection site soreness, just like you get with any vaccine that goes away self-limited, and really that's kind of the extent of it.
All right. Dr. Vin Gupta, do you have your booster?
No, I've documented my immunity.
Okay. I'm not going to ask you, Congresswoman.
I got it.
See? Look at that. Congresswoman Donna Edwards, who practices what she preaches, and Dr. Vin Gupta, love having you in studio.